You're listening to the Business Wealth Impact Podcast, your source for empowering information and cutting-edge ideas from the world's top minds. I'm your host, Jeanne Amlour, founder of seven-figure coaching company, Jeanne Amlour International. Join me on a journey to unleash your potential and create your highest success. Welcome to Business Wealth Impact. Hello, and welcome to another fantastic episode of Business Wealth Impact. Today, we have a fascinating guest. Dr. Jamie Justice, PhD, is Executive Director of XPRIZE Health Span, an EVP of Health at XPRIZE Foundation, and an adjunct professor of gerontology and geriatric medicine at Wake Forest University School of Medicine. Now, in her current role at XPRIZE, she operates the 101 million global health span competition. Welcome, Jamie.
Hi, thank you. Thank you so much for having me on.
Oh, it's a pleasure. So first of all, for people that don't know, why don't you explain what XPRIZE is and what's going on with that?
Of course. So if you don't know what XPRIZE is, don't feel bad. I got a call about a year ago while in my academic office. I was leading a lab, had great things going on, and I got called about XPRIZE. And at the time, I had no idea what it was. I thought I was going to maybe be an advisor for a really exciting prize. Ended up being something totally different because I really fell in love with the foundation. So if you don't know, XPRIZE, it is a nonprofit foundation. And it's unlike any nonprofit I've ever heard of or been involved in. It is dedicated to inspiring and empowering humanity to achieve breakthroughs that accelerate an equitable and abundant future. So that's quite a mouthful. So if you really want to break it down, we're really the world leader in incentivizing large-scale global competitions. We're philanthropically funded primarily. And we support really major prizes. I mean, anything from the hundreds of thousands to millions of dollars worldwide for things like science and technology, carbon, health, genomics was even an area, biodiversity, climate, wildfire, and everything in between. So again, it's a very exciting thing. What we do is we launch major prizes. Over the last 30 years, we've launched 30 prizes with over $500 million in prize money. And the real sweet spot of XPRIZE isn't just running prizes. We run prizes to make an impact. And so I think one of the more remarkable little flags for XPRIZE is that by putting these large prizes out there is that we're able to actually achieve more than a 30 times impact for every dollar that's invested into the prize purse. So again, this is teams have to go out, they have to raise their own funds. We pull investor summits together. We raise money for really critical areas that are either underfunded or really need an acceleration that they're not getting from the current market or other funding strategies. And so again, this is a chance for us to make a large scale difference in a way that's not being done currently so that we can catalyze solutions for the future.
Okay, so the founder of this is Peter Diamandis. Okay,
That's right.
Right. Now, actually, just full transparency, I am actually a member of Peter Diamandis' community, which is called Abundance 360, and I love it. Right. And that's actually how I came across Jamie. So Peter has done how many of these now?
Oh my gosh, we have launched 30 prizes in 30 years.
Wow.
So Peter, if you don't know him, he is a lightning rod. Of a human.
Absolutely.
Peter sets his mind to something, he just says, okay, guys, this is where we're going and this is what we're doing. Get on board. Right. And we do. Right. And it's great.
It's amazing. Now, I think the first XPRIZE had something to do with space, right?
Space, you're absolutely right. So space is one of Peter's passion areas. So again, Peter always had dreams of being an astronaut, and noted that there's was a real lack in the space, and that at the time it was illegal for commercial spacecraft. So there was no option other than government-funded craft if you were looking at space or actually wanting to travel, or again, and that's great. It's wonderful to have federal funds, but you're really missing out on a lot of opportunity and really quick advancement that can happen by incentivizing a commercial pathway. And so what they did was they put out a $10 million prize. And, again, with prizing, their goal wasn't to go to the moon.
Mm-hmm.
Peter takes these big ideas and puts them down into really sort of bite-sized chunks
Mm-hmm.
that are audacious but achievable. So
Mm-hmm.
they're achievable, and for $10 million, people had to create a spacecraft. You had to have 3 people board that craft, and they had to go 100 kilometers
Mm-hmm.
twice within 2 weeks. So it had
Mm-hmm.
to be a repeatable manned craft, and it had to
Mm-hmm.
be commercially driven. And so
Mm-hmm.
they put this call out. $10 million is not a lot to go to space. And
No.
so you can imagine teams had to, in general, had to spend at least 10 to 100 times that prize purse amount to get there.
Right.
But the return on that, again, 10 times to get there, the return on that now, as we've seen with the commercial space industry, 100-fold. And in the process, they changed
Amazing.
regulatory policy.
Yes.
They had to get, again, major shifts in how we approach and think about space.
Mm.
So again, this principle started there, and they've applied it 30 different times to 30 different prizes. Most of
Mm-hmm.
those have been awarded. Some are still in action, with over 300 million awarded, I believe over 500 million launched. And
Amazing.
so I'm really excited. This was, again, an opportunity when I
Mm.
got the call out of my lab. And
Mm-hmm.
Peter, in addition to loving space, he also loves all things tech and AI. And one of his other big areas for philanthropy and investment is health and longevity.
Right, right. Okay. So the first one is actually more about it being a catalyst than anything else. That's and
Yes.
Peter is a catalyst. Okay, so let's fast forward to this particular X Prize really fascinates me because I am very into longevity. So
Yes.
let's just share with people what this project is about now.
Oh, absolutely. So this project is my heart and soul. It was so funny. I've been working in the academic space and thinking about aging and the biology of aging and therapeutics and what we can do for my entire career.
Mm,
And I got a call from Peter that he had raised over $100 million to run a prize in exactly my heart space, my scientific experience. And
mm,
so this is XPRIZE Health Span, and it's a 7-year, $101 million global competition to change the way we think about and treat human aging.
mhm,
So again, it's a it's a very big mission, but it's one that's incredibly important. And so, what we're asking teams to do is that they're actually going to have to run small clinical trials. And so they have to develop a therapeutic, and the winning team is going to be the team that can administer that therapeutic either alone or in combination. And they have to restore muscle, cognitive, and immune function in
mm,
older adults.
mhm,
And again, this is 1, 2, or 3, and that magnitude. So, how much of a change they have to do is they have to show that it's anywhere from 10 years to 20 years of improvement in order to
mm,
win that award. So, again, this is a really difficult challenge. It's a really difficult prize. My job is to set up the framework.
mhm.
And so, how do we know if a therapeutic is successful?
Right.
What scientific community do we have to wrap around this prize? And how do we catalyze a global community and network to actually come together to begin to address this for the first time?
Mm.
And so that's my role, and that's what we're doing. And it's so far it's been an incredible adventure, and we're just getting going.
It's fascinating. Also, let's face it. If you have all these teams competing, human
Yes.
competition makes everybody thrive because now they're on the clock. They have to make it work. So no matter what happens, that's going to push that so much further and advance
Oh,
that whole thing of apparently it's like how to make the last 10 years of human life better because the last 10 years of human life it's pretty hard, right?
yeah, you're absolutely right. And so this is exactly the key: is that this is a health span prize.
Mm.
And so where this prize came from, it really is, you know, people around the world were living longer, and actually about 30 years longer for most
Mm.
countries than we did 100 years ago. And that's, I just want to stop. That's actually full stop. We should stop there for a moment. 30 more years now. So this isn't just a prize for the future. This is, we are right now living longer, and we don't know what to do with those years,
Mm.
because the additional years that we have, they're not necessarily better.
Yes.
Looking at World Health Organization data, if you really look at it by the numbers, and the US alone, we are actually living in a period, we have a 12-year gap between what we call our health adjusted life expectancy and our
Mm.
actual life expectancy. So
Mm.
that means we're living in a 12-year period with multiple diseases, major chronic conditions that limit our quality of life,
Mhm.
and disability. So again,
Mm.
this isn't just maybe I have, high blood pressure I need to manage. Like this is a real quality of life issue for 12 years. And
Mm.
so we know that this is the problem. We know this is an issue, and we know that it's challenging our economic systems, it's challenging our families, and it's challenging
Mm.
ourselves. And
Absolutely.
so, this is beyond a single disease. And we've
Mm.
only been able to develop medicines and therapeutics that target diseases, not health. We don't
Right.
understand health.
Right.
And so this is a chance for us to really make a change in how we consider proactive versus reactive medicine,
Mhm.
how we can target basic biologic pathways to actually improve our health as we age. And it
Mhm.
goes beyond our traditional one medicine to one disease paradigm
Yes.
for how we've approached medicine. So again, we're trying to break a lot of barriers with one prize, and that's why it's such a big one.
Well, no matter what happens, there will be great advancement.
Absolutely.
Yeah.
And so far, I mean, we've just started. We just opened for primary registration for our team. So far, we now, as of today, this morning, I checked our numbers. We're at 430 teams worldwide who
Wow.
have signed up to compete. And we're
That's
going to be open
incredible.
for the rest of the year. We expect well more than 500 teams to sign up to compete.
Okay, this is awesome. All that brain power, all that human effort. So now I'm really fascinated, and I've been fascinated. Why 101 million? Is that just what people donated and ended up being 101 million?
No, no, the story is even better. So again, you're talking about the power of human competition.
Mhm.
Okay, even better. So a couple years ago, XPRIZE launched its biggest prize ever.
Mhm.
This was a carbon removal prize. That it's the
Mm.
Musk carbon removal prize.
Yes.
Elon Musk put this forward, and that's the prize
Mhm.
money. And it was 100 million, and it was the biggest
Mm.
prize ever run. Peter, again, health is his passion area. Longevity
Yes.
is his passion area. So he went out and he started fundraising for this prize, and he went to people within his community, and he went to other folks that are really invested in the space. And he started actually with a conversation with his dear friend Chip Wilson, who was the
Mhm.
founder of Lululemon.
Mhm.
And in talking to Chip, he said, "Okay, I think we need to make this 100 million so that it
Mhm.
matches this other big prize." And
Mhm.
Chip put his foot down. He said, "Well, I'll contribute." He said, "But it has to be the biggest. I'm going to give you an extra $1 million." So so we are the biggest prize launch to date,
Now I
and that
know.
is global. Yeah.
Yeah.
So
I was wondering about the one, and I thought there must be some marker they had to get the one, and there you have it. So,
yeah,
it's so interesting what you say about what I think happened is that people were used to dying earlier, and then
that's right.
medicine got better. That's great, but their health habits didn't get better. And
That's
I'll
right.
tell you what really affected me. About 14 years ago, we were at some, resort with my kids, and we were getting on one of those shuttle buses, and I will never forget this. And this old guy like hobbles onto the bus and he sits down and he looks at his wife and he says, "Huh, if I'd known I was going to last this long, I would have taken better care of myself." I thought that to me, I never forgot that. I thought that says it all. If I had
Absolutely.
known that I was going to last this long, I thought, "Whoa, wow, that is mind-blowing." He
It
thought
is.
he was gonna be dead already, so he wasn't planning for the future, and I thought that's the mindset. That's great to know that if you educate people, you're gonna live longer, so you don't wanna make that terrible. You don't wanna
That's
live
right.
right? But it
That's
it was
right.
just so succinct that I never forgot that, ever.
Yeah, and it does. It reminds me of another. Again, I know this isn't a show about Peter, but another Peterism, right? Don't die of stupid things.
Right, right.
Is that this is one of those that the more you know.
Exactly, yeah.
And it is. And we're only a few lucky generations that have the
Mm,
opportunity to live this many springs. And it
right?
really is. It is the opportunity, but it
It is.
is what do we do with them?
Mm.
So I think that's one of my drivers is I want to live every day that I'm alive.
Yes, you wanna live it's not about living longer and having all these disease. Quite frankly, I think most human beings don't even wanna live that kind of a life. So
That's right.
it's not just about longevity, it's about longevity with good health and being able to function and have happiness and joy and purpose and a normal life, which is what Peter's I think that's what his mission is, right?
That's exactly the mission. And so,
Right.
and certainly that's the mission of the prize. That's the mission of our sponsors and our founders. And, and it's definitely is also the mission of our scientific advisory board and others, is that we
Right.
have a really large team helping to drive this effort forward of, again, really remarkable people that
Mm.
they get it, they understand.
Hmm.
Is that there is a great challenge, and wherever there's a great challenge, it's not a reason to go bury your head. It's time for a great opportunity, and we just have
Right.
to figure out how to unlock it.
And also, every single person working on this benefits them. Like,
It
this is
does.
one thing that, maybe the space didn't benefit everybody if they're not interested in the space. But this, everybody's like, yeah, I really want to figure this out because I'm going to get old. And I think that's super. I thought about that. I thought, who wouldn't be motivated to figure this problem out, right?
Well, you're right. And so it's not just whether we get old or not, it does affect everyone. But I think some of the hidden barriers, right, is when we think about aging and we think about some of the economic consequences, our mind often goes towards medical care
Mm.
and the how much it costs just to maintain chronic illnesses,
Mm.
and what that load is like. But if we actually look at the economic consequences of our current system, where we don't take care of persons who are aging very well, is that really the economic costs from people coming out of the workforce
Mm.
early
Hmm.
or for extended periods, and not just themselves, but really their caregivers and their loved ones. And so, we're really struggling figuring out how do we care for the people who are aging now with us.
Mm.
So, again, for anybody who thinks that this is just a pie in the sky kind of immortality thing, is that
Mm.
no, we're talking about real human issues that
Yes.
need solutions. And
Hmm.
again, this is a whole societal thing that we do need to come together. But this is one possibility, is that if we can use this prize to unlock this proof of concept, this idea
Hmm.
that aging is somehow treatable,
Hmm.
it can be targeted with therapeutics, and
Hmm.
it's a malleable process. It's not this inevitable march and decline that we've come
Hmm.
up with.
Right.
Is that there's great purpose, there's great engagement, there are things that we can do. And so this is just one aspect of really trying to build this broader narrative about how important our aging populations are, and they should be a cause for celebration. And we just want to
Mm.
make an opportunity for that.
Right, because let's face it, most of us, when we think of older age, the picture, the visual we have is,
Yeah.
oh, a ton of medicines, not being able to walk. No, I'm serious. When you think
You're
about that
right.
now, you're thinking, oh, they're going to get older, ton of medicines, not walking properly, maybe heart attacks, being in the hospital all the time, uh, you know, just living. Because, we've all had parents and relatives that was their end of
You're
life,
right.
right? So I think it really is also about changing our paradigm on what we're visualizing our older age can be, right?
Absolutely right. And so I think this is one of those, and that we haven't, even though we're living longer, we have a lot more of us living longer, and there's so much more that we could be doing with those years.
Mm.
When I think about this, that if we're successful, if this prize and when this wins, this prize and all of the other work that happens around it, if we have this fundamental change on how we perceive and understand aging, we open up opportunities for lifelong learning.
Mm-hmm.
What other degree would you go get?
Mm.
What changes would you make in sort of your society and your family? How are our communities changed to actually embrace a really enriched older age?
Mm.
How does this change sort of our concepts of multi-generational workforces
Mm-hmm.
and opportunities? I mean,
Mm.
it really unlocks a whole other conversation that we haven't allowed to happen because we're too afraid to talk about aging.
I agree. It's just this taboo. So now tell me, after the 7 years passes and
Yes.
somebody wins, then
Yes.
what happens? They get $101 million to do what then?
This is great. So again, so we're going to take the 101 million, and 7 years is a very long time.
Mm-hmm.
So we do take that 100 million, and for the first time in one of our prizes, we're breaking it up into a couple of milestone awards. So
Oh.
actually, you can follow us closely at the beginning of 2025,
Mm-hmm.
right around March and April. We're going to be making our first announcements, where we're going to go
Mm.
through our qualifying submissions, all these hundreds of teams, and we're
Mm-hmm.
going to pare them down to the top 40. So there's
Mm.
a $10 million award that gets distributed across those top 40 teams, and we'll have a nice award ceremony and
Mhm.
investors summit for anybody who's interested in investing in this space. It'd be a great
Mhm.
time to come meet the companies and teams. Those
Mm.
teams go on and they're going to run really small trials. So this is a way for them to show us that they have a clinical center, they can recruit people, they can get their regulatory paperwork up and running.
Mhm.
If they're using a drug or a device or a biologic, that they can figure out how to administer that and exactly which ways. And so
Mm.
that's the first stage. Then we're going to look at
Mm.
those 40 teams, those run those small trials, they submit everything to us again. Our judges will review it. They're going to make another award. So they're going to give another
Mm.
10 million to 10 teams.
Mm.
And then those teams go into the finals. So with the finals, we'll have from 2026 up to 2030, be able to follow those 10 teams as they run their clinical trials. We can meet them, we can engage with them. There's going to be team summits, there's going to be documentaries following this. It's going to be a lot of fun. And
Mm.
so, again, a huge haul to get there. So every milestone is a chance for us to engage our scientific community, our
Mhm.
regulators, those around the world that are interested in competing and participating, whether as a partner, a research participant, or joining a team.
Mm.
And so, again, huge journey across 7 years. And then once we get there, that team who wins, and honestly, we even if we award only one team, I think there could be several winners.
Oh,
Is that
yeah.
we're separating this, right? We're saying that all teams, they have to show an improvement in muscle,
Mm.
cognition, and immune function.
Mhm.
From talking to larger pharmaceutical companies and others that are really watching this space very carefully, they said any one of those would be a winner for them,
Mhm.
even though we're only awarding somebody, you've got to do all three.
Mm.
And so for that company, they get awarded this money. And really, what that becomes is a seed
Mhm.
to do the next bigger trial. So,
Mm.
sort of like we're going back to space, right? The
Yes.
original prize was not to go to the moon, but
Yes.
that prize money becomes the seed for them to develop the next thing and
Mhm.
ultimately to create a pathway for commercialization that wasn't there before.
Right, because even if they get one of 3, the pharmaceutical they're gonna say,
Super
"Hey, we're
excited.
good with that. Here's some money just to develop that one," right? But
That's right.
but I was doing the numbers while you were talking. You're gonna need more than 100,000,000 because you said 10 get 10, that's already 100, but then you had already given 40,000,000 away. So you have to you have to bring more funds in, right? Along the way.
Oh, no, no. So by the end, the total award amount is 81 million.
Oh, okay.
Okay, so total purse is the 101, and then we divide it where we have 20 million goes out to those milestone prizes.
Oh,
This is
okay.
the first time we've done this. And so
Okay.
from experience, so for my work as a scientist, when I was going to run a large and worked with a really great team, so it wasn't just me, trust me.
Mhm.
We worked with a great team over many years to develop a trial to create a regulatory pathway for
Mhm.
aging. This is called
Mm.
the TAME trial, targeting aging with metformin.
Mm.
And metformin's a generic drug, so it's
Mhm.
really that's the cheapest trial we could possibly run. And we spent a lot of years working back and forth with regulators and our scientific community and other key stakeholders to create an outcome for this
Mm.
trial, so that you can have like a labeled indication for aging and multimorbidity. Huge win for the field if we could get there. To run a trial like that with a generic drug, that was around 78 to 80 million dollars to run that
Mm.
scale of a trial.
Mhm.
So the award money that our teams would get could actually fund that scale trial for them to really advance through, so that we can collectively finally get a drug that's approved for
Mhm.
aging. And not just a drug, because it could be a device, it could be a personalized approach, it could be a biologic, it could be some combination, but we would make really, really big inroads to actually beginning to address and tackle this really
Mm.
much greater challenge.
Wow. Okay, so Jamie, why you? What
Yeah.
makes you perfect? And let's hear a little bit about. I mean, you're perfect. What I meant was makes you perfect. You're just perfect. But what makes you perfect for this job? I should have stopped at perfect, right? But
Yeah.
that was my original question. And what's your pathway? I mean, you got a P. What do you have a PhD? And let's hear a little bit more about you now.
Oh my goodness. Yeah. So, in retrospect, I guess I was perfect for this field, but it's one of those things you don't notice.
Mm.
When I was really young, I used to collect little critters. I had very tolerant parents. And so, like, we would go camping. And I remember going camping in the desert, and we would put our shoes outside on our camping trips. And you had to wake up in the morning, you had to pop your shoes because there would often be scorpions that crawl up into the toe
Mm.
box. And so I had a scorpion that I found in my shoe, and I begged to be able to keep him as a pet. And so I named him Elmo, and this was just very characteristic of my childhood. I was loved it. And so in fourth or fifth grade, I had this scorpion Elmo, and he needed to eat crickets. So I
Mm.
ended up running my first lifespan study on diet and nutrition and lifespan with crickets in the fourth and fifth grade. Is that I had a little kid's kitty cat calendar,
Mhm.
and I would track the number of crickets, and then I put
Mhm.
them in different housing containers, and I fed one potatoes, one apples, and one oranges, these different houses, and would count how many crickets there were, how long they lived, and what they did. And because I had to have these feeder crickets for the scorpions. And
Mhm.
so little did I know that was my first ever science fair project. I ended up submitting it and winning. And now looking back on it so many years later, once I actually started getting into science, first I was studying neuromuscular function and performance and fatigue. I was studying athletes and young adults, and yeah, that was fine. But my PhD mentor said, I had this question about aging, and that, this thing about fatigue and aging and whatever. And he asked me if I would tackle it during my master's. And so I went into this and I fell in love. I mean, I really did. Is that
Mm.
working with older adults, the questions we were asking, the things that we were doing, and realized only then in retrospect that, I think my entire life had been building up to this and I just didn't
Aw.
know it. It
Mhm.
started with crickets and went to actually trying to figure out, what determines our health and loss of function as we age.
Mm.
And then so I did that through my early graduate work. And then by my as soon as I finished my PhD work, is that I began thinking, okay, I don't just want to characterize how we change
Mm.
with age. I want to think about what we can do about it.
Mm.
Is that I'd been working with older adults, had been doing also translational studies. So that means that I would be in the clinic working with older adults and doing clinical trials in the morning. And then in the afternoon, we would often look at the same kind of diet and lifestyle interventions and even nutraceuticals or drug interventions in mice, because we can study lifespan in mice. You can't really do that in humans. So then,
Mm.
I was doing both. And
Mm.
and I really fell in love with working with older adults, thinking about these questions, and it didn't make sense to me anymore once you start to know the field and you start to know the numbers. Is
Mhm.
that many people go in and they start studying diseases and you fall in love with your disease pathway.
Mm.
To really understand what aging is that it's everything. It's more than one disease. It's the primary risk factor for every disease. And that there have
Mm.
been really great studies and modeling that looks at, if you actually went through and if you could create a cure for cardiovascular disease at a population level, you'd only extend population lifespan by maybe 1 or 2 years. If you
Mm.
cured cancer, all
Mhm.
cancers, cured them
Mhm.
2, 3 years,
Mm.
because underlying each of these major disease classes, we still have this biologic construct of aging that,
Mhm.
unless we truly start to understand what that biology is, we're never going to make a dent in how we live our lives and how we function in old age
Mm.
that we now have. And so, again, really looking upstream from the disease, looking upstream for those one-to-one kind of current medical approaches,
Mhm.
and start thinking about what we can do to change the things that actually matter to people.
Right.
Because in running those early trials, is that what we found mattered to people. If spending time with people, running
Mhm.
clinical trials, meeting them,
Mm.
going to their homes, some of them, take me out for coffees and banana breads. And like we had, again, really, really
Mhm.
rich experiences.
Mhm.
What matters isn't whether or not they are on blood pressure medication. What
Mm.
matters is being able to continue to participate,
Mhm.
having the physical ability to play with their grandchildren,
Mhm.
to have the cognitive ability to be able to sign up for clinical studies, to remember
Mhm.
a grocery list while walking around the
Mm.
store, to be able to multitask while talking to their grandchild in the back and still
Mhm.
drive.
Mm.
And we just went through a pandemic. Is to have the immune resilience to be able to leave your house and actually engage with your neighbors, with your
Mhm.
family, with others.
Mm.
These are the important things. And then
Mm.
unless we actually find a way to start talking about non-disease pathways and how we support health and function for any age,
Mhm.
I think we're going to have limited results as a population.
Absolutely. I'm just thinking about all the interaction you had. There's such gold in that, just speaking to
Yeah.
older people, right? Just the stuff they come up with because the long lives. It's just so enriching. And I think most people don't really get to speak to older people much like you have.
Oh my gosh, it's so amazing. So, I mean, I was doing work with younger athletes. And so my first studies were looking at young adults and then was looking
Mhm.
at old adults. And we were doing all these fatigue tests and performance because I was an athlete. So I was interested in these questions. And I started working with masters athletes. And, um, and I immediately became so bored with working with the young athletes. Their questions, their concerns, their lives, it
Mm.
wasn't that interesting.
Mm.
If they could improve their VO2 max just a little bit more, when I was
Mhm.
talking to somebody about, wanting to hang on to their, their master's
Mhm.
titles and their work and like what it really means to them.
Mm.
And then again, to really generalize that beyond the athletic population, just to a general population
Mm.
is, how are we engaging in our lives? That's fun. That's the fundamental question.
It does beg the question when you think I was thinking, what about these people that are so talented and experienced in anything, arts or science or
Amazing.
whatever, and then they stay healthy and they're able to continue developing
Amazing.
what they were good at instead of getting dementia or sarcopenia or whatever it is. Because I was thinking the main things are the mental, Alzheimer's, senility, and all that, but it's
Yes,
also the muscle loss,
that's right.
right? Those are those like the two main things?
And the immune system
Yeah,
drives it
the
all. I
inflammation problem.
really have to say it.
Mm,
So, the immune system, I think we learn over and over and over again just what an incredible driver of multiple disease processes and also non disease processes
mm,
is that it's intimately linked to our health and to
mm,
our resilience.
mhm,
So again, all of these interact together, and it's
mhm,
not that they're distinct from one another. Like there is a
mm,
major, major connection between brain and body.
mm,
Right. So, as soon as our cognitive ability begins to slip, does that influence our functional ability? As
mm,
we lose our mobility and our function, does that influence our brain so that we have more cognitive decline? And
mhm,
immune insults particular. So if you either have a fall or an
mhm.
exposure or a virus or something, is that there are direct implications between
Yes,
inflammation in the brain. And so
absolutely.
these aren't separate systems
Mm,
any more than your heart and your vascular, your pulmonary systems. Like they're all
yes,
really integrated. But when we're thinking about function and disability, that these are main drivers. And so they're the things that we want to start with.
yes, because, like, my mother fell, and that was the
Oh,
beginning of the demise. She passed
oh,
away the
absolutely.
fall, and we know that when they fall, then that created a problem, other things and inflammation, and then they found out that she was riddled with cancer. Like, but
Absolutely.
she died 3 years ago, but what
I'm
was
so sorry.
extraordinary yeah, we knew the fall, oh, no, that the fall, you're
Mhm.
right, and then they did a upper body scan, and they found so many different cancers. They said, "We don't even know why she has no pain, it was a miracle." They said, "We're not
Yeah.
even gonna bother, this is not gonna last long." But there is that thing, you're right. Also, I think it's fascinating what they're doing with the gut research at the moment.
Oh,
That's pretty new.
absolutely.
Like, that's gonna change. I'm really interested in microbiome, and I'm interested in these new microbiome companies, actually. I've invested
Me
in a
too.
couple, actually. Yeah, I mean, I think that's huge new information that we were
Absolutely.
not focusing on the gut, were we, before, like,
No,
13 years ago? Is that when it started? Yeah?
not at all. No, gut brain, gut immune, it is so important.
And new. Well, listen, you have been a delight. It's been fascinating to have you. Well, I would like to hear as we part, what's your one thing you want to share with people, whether it's about longevity or philosophy or mindset, as we close this show?
I don't know if I can give you one, so I'm gonna give you 2.
Okay.
One is, I think, really important, and that's the essence of competition and collaboration.
Mm,
Right, is that I think we bring out the best in each other. And I honestly think competition is actually next to collaboration. I don't think they're distinct. Is that
mm,
we can choose to sign up and we can show up, we can engage, and we can solve and tackle our largest problems together. Those are
mm,
things we can't do alone. So, again, whether that's in pursuit of a prize, creating a company, developing a network, partnering with friends, engaging with family, is that there's a real chance to get together and try to drive something forward for the positive. It's never too late and it's never too hard as long as we
mm,
work together. And so that is one of the biggest drivers in my scientific work and also now in my role within XPRIZE Foundation and leading health and leading this large collaborative community prize. It's global and it's real.
mm,
So that's one of the biggest things that I would like to leave with. And that's, under it all, a mission of hope, right? And then the final, I'll reiterate it again. I said it earlier, but I just want to live every day that I'm alive. And I think that's
Mm.
the real goal. And so, and I think that's further than just prize or thinking of longevity, but anything else. I think it translates really well to business. It translates to our
Mm.
relationships. I love having a mission and a drive and people to do it with. This is how I live, and encourage others to do the same.
Thank you so much. To recap, never too late, never too hard. We are stronger together, and you want to live every day of your life. Jamie, you're a pleasure. Thank you so much for turning up.
Oh, I'm so glad to be here.
Yeah, me too. And I'm just so thrilled for you because you are definitely in your element. Peter did a good job recruiting you. So thanks again. I hope you enjoyed this episode. Please subscribe, share the love, and we will see you on the next one. You're listening to the Business Wealth Impact Podcast, your source for empowering information and cutting-edge ideas from the world's top minds. I'm your host, Jean Amlour, founder of seven-figure coaching company, Jean Amlour International. Join me on a journey to unleash your potential and create your highest success. Welcome to Business Wealth Impact.